Hello, my name is Dr. Paul Wicks, and I'm the Director of Research and Development at Patients Like Me. In this presentation, I'll be going over the history of how ALS patients have used the internet to form connections with one another in order to empower themselves and seek support. The internet is a vast computer network of networks that allows rapid and secure transmission of data. Over the past 2 decades, we've seen use of the internet move from the obscure to the mainstream, to the point that the web plays a major role in our lives, whether that's entertainment, communicating with others, or as we shall see, sharing health data. Like the developing human brain, the more connections that are formed, the more powerful the system becomes. The earliest signs of internet discussions around ALS date back to 1992, when Bob Brodel's weekly ALS Digest started off as a circular email to 14 interested subscribers. By the time the email ended distribution in 2002, it had over 6,000 subscribers composed of patients, caregivers, healthcare professionals and researchers in the field. A complete archive of the emails can be found through the link shown here. Throughout the late 1990s, a number of the ALS non-profits started getting online, with the ALS Association and ALS Society of Canada among the early adopters. A Usenet discussion group was also launched in 1996. The websites of this time were what we now call Web 1.0. They were static sites that did not change much over time, providing expert-generated leaflets and web pages that could be downloaded and read. The sites themselves were still relatively small, as demand for online content was mostly restricted to relatively technical users. However, the dot-com boom of the late 90s meant that the web was increasingly recognised as an efficient way of communicating with patients. Over the next few years, a new type of website became more common, which featured online forums or message boards, which allowed patients with ALS to communicate with one another in order to share helpful information and emotional support. As patients started becoming more familiar with scientific and medical terminology, they started teaching one another to become expert patients who could navigate their medical system and in many cases knew more about ALS than their own primary physicians. A prominent example of such a site was BrainTalk, an online community that at its peak contained 1 million posts from over 50,000 members with a variety of conditions, including ALS. Associated with Massachusetts General Hospital and Harvard, the site attracted patients as well as healthcare professionals. Unfortunately, a massive server crash in the summer of 2006 destroyed most of the data, and it has been a slow process rebuilding the site. A similar site called Build was developed by King's College Hospital entirely for people with ALS, known as MND in the UK. Build serves as a virtual branch of the MND Association and is a useful sounding board and a ready source of patient advocates. In addition to message boards, Genie's ALS chat room serves as an example of a site where patients can participate in a live, real-time chat session with other patients around the world. Unlike a message board, communication is instant, which can be a problem for members with slower typing skills. However, the community is hugely supportive and fulfills an important role in the online ALS world. Regularly scheduled events include a girls-only chat that takes place each week. Moving to the future, the movement now is towards Web 2.0 sites. This simply means that the emphasis is on user-generated information, which grows and changes over time, rather than a static source of expert-provided content. These sites promote the web as a platform, in much the same way as Facebook or YouTube have become platforms for sharing social data. The explosion of high-speed internet access has meant that the average ALS patient online is now much more representative of the general population compared to only a few years ago. The ALS Care Programme and the ALSOD SOD1 online database programs are examples of online databases that healthcare professionals can use to increase knowledge about ALS. The website of the ALS Therapy Development Institute is an example of a fully integrated open source research philosophy that allows patients to see the progress of preclinical studies evaluating treatments for ALS, as well as discussing research with an expert, Dr. John McCarty, in their forum. Our own website, Patients Like Me, emphasises the sharing of personal medical data to help patients learn more about their condition and improve their outcomes. Sites such as these ensure that the ALS patient community will continue to be more connected and empowered in the years to come. Would you like to know more? Visit www.patientslikeme.com.